a couple of examples of what you're going to run into, okay? Here's our patient. Okay? He's in early recovery. He's doing okay, okay? Now, he's a guy. How old is he going to be?
23.
23. He's a 23-year-old male. Let's give him a name so we know who he is. Go ahead, Jess.
Pat.
Pat. Patrick? Pat? Okay, here's Pat. 23 years old, right? Now, he's arrived here in early recovery. Now, when I say for the most part, when it comes to processing feelings, our patients are going to have to resolve or process unresolved feelings from their past. Remember, you've heard me say that. So let's go back here with Pat. Okay, going to psychosocial. How old was Pat when he started drinking and using and smoking pot?
14.
14 years old. So he was 14 years old here. And that's usually about right. It's usually 13 or 14 when I've interviewed thousands of patients. But it's usually around 14. So if he's 23 or 24 now, we know he's been using for 9 years. Now, if this was 34 or 44, that might be, when we talk about individual treatment, patient-centered individual treatment, we would treat somebody who'd been drinking and taking drugs for 30 years more than, they're a little bit different than we would someone for 9 years, okay? So whatever this age is like this, he's got issues here, back here, 14, 15, 16, usually family, it could be anything, well, you know what it could be, right? It could be anything, okay? So, when he's here, let's just say he's got 40 days clean. Right? And he's dealing with some issues here. So he's over here, 40 days clean, okay? And he's dealing with some issues here. Now, let me somebody give me an example of an issue that's going on here.
Guilt.
He's feeling guilty, right? About what? About something back here, right? Okay, so, he's feeling guilty about something back here. Now, when we talk about what the patient is feeling, let me give you an example of what you might hear and what I have heard from patients. Now, in part one of this, on the content and process, where I said, in group, and we're going to do something about group later on this evening, but in group is not a complaint session. This isn't a complaint group. And I don't let the patients complain in group, or when you were talking about before, when you said, how do you stop them from telling a story? Like they're telling a long story about, my sister and her boyfriend from college, and a long stories that have nothing to do with anything. We don't let people tell long stories, because they'll talk about that. They'll smoke all day long, right? So, the patient is saying, he's on probation, like that one who was on probation. Here he is in group here now, and that goddamn probation officer of mine, he wants me to come every week now. I was coming twice a week, and son of a bitch, he wants me to come every week, and I don't know why, I'm doing it. They'll go on like that, right? Now, does that have to do with treatment that we're doing with this patient? Is that treatment? Is that something we would deal with in treatment?
Yes. Guilty.
No, not guilty, but he's complaining about his probation officer.
No.
What?
I think that you have to deal with it on some level. It's affecting his...
No, we don't do complaint sessions. If he's complaining about his PO is treating him unfairly, is that what is really going on with that patient?
No, because you
No.
don't know what the real reason is.
Right, well, what is he feeling? Angry, he's angry. Okay, at who?
Himself.
The probation officer.
No, he's not angry at the probation officer. He is angry at himself for being on probation. Okay, so he doesn't know it. But if he's complaining about his probation officer, that son of a bitch, who's always, he came to my house at 6 o'clock in the morning. They're like that, complaining. My PO came to my house at 6 in the morning and woke my mother up, too. And everything was okay, he didn't find anything. He looked at the refrigerator, see if there was alcohol. There was nothing there. Right, so what he's doing is, in treatment-wise, you want to address, why are you on probation? And it's something over here. Why are you on probation? That's what he's angry at. He probably did something over here, stupid, dumb, stole a car, whatever, got caught with drugs. That's what you want to do. You want to focus the patient on why he's on probation. Don't let them complain about being on probation. Point out to them, well, why are you on probation? And try to address that with them. Because he's angry about something that happened back here. For the most part. You can, if somebody does, sometimes they want to get some steam off and you want to let them vent, and that's okay. But you got to focus them on why they are feeling that anger about that at their probation officer, when really, for the most part, they're usually angry at themselves for screwing up somehow that they ended up on probation. Okay, does everybody follow that? I'll give you another example. This is a real life example, okay? The patient was complaining that he went down to social services because they canceled he didn't get enough money on his food stamp card. And he went down to social services, and he was there for 3 hours before they saw him. And he's in group now the next day complaining about being at social services in the waiting room for 3 hours. Because of blah, 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 blah. Okay, so, again, you want to point out to him, why are you on social services? Why do you have to get, what are you really angry, what are you really angry at? And they're usually angry at themselves. Okay? Another one, real life example, the patient was complaining that the light was out in the hallway of his sober house for 2 weeks. And he told that son of a bitch house manager to change that light bulb, and he hasn't changed that light bulb. It's 2 weeks. And when I got to go to open my door, I'm in the dark, and really, he's sitting, thought he was going to take 10, 15 minutes of the group time complaining about this. And that house manager, he's not doing his job, complaining about that. Okay, so what's the real issue with that patient?
Why are you at a
Why are you at a sober house? What are you doing at a sober house? Because you just got out of treatment, you can't get a job yet, you can't support yourself, you're still in treatment, you're still in outpatient treatment. The sober house is part of an outpatient program, and you're here in treatment with us while you're in the sober house. That's the issue that has to be dealt with. That's what they're feeling, whatever it is they're feeling. We're going to get back to that guilt thing because that's important. People say to administration, get the light bulb changed, but you're not going to sit in your group for 5 or 10 minutes complaining about the house manager not changing the light bulb. And it could be our house, it could be any sober house. If it's we might have a little more control if it's one of our sober houses. But I mean, we change them, get the light bulb changed. I've fixed the bathroom thing was overflowing at the treatment program. Now, I'm the clinical supervisor. And the bathroom they said the bathroom was running. And they told me, so what did I do? I went in there, picked up the thing to see what was overflowing. There was a bottle of urine in there. They used it for urines. For fake urines. It had got clogged up on the thing and it was overflowing. But I've changed toilet paper, unplugged plunge toilets. And, take my jacket off, roll up my sleeves, and get in and do that. That's something that's easily resolved. But I would point out, why are you in the sober house? Why aren't you home? My wife doesn't want me there. Why doesn't your wife want you there? Because blah, 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 blah. Guilt. Can't go home. That's something that we would deal with back here. Okay, does everybody understand that? Okay. So this is the type of things, what people say and what's really going on with them when it comes to process and how they process their feelings. Okay?